And now I'm glad to welcome our next guest on the program, Dr. Alessandro Franciosi, who's a consultant respiratory physician, to talk about COPD. So thanks for coming on the program, Dr. Franciosi.
Good morning. Thanks so much for having me.
COPD, I think most people have sort of heard about it, but a lot of people may not know too much about it. So maybe if we could just start with a little kind of definition of what it is.
Yeah, certainly. So you're right. Many people do report having heard about it, but when asked what their understanding is, it can often be quite limited. That's probably because it's what we kind of call an umbrella term, I guess. It covers a couple of different conditions that very frequently, if not almost always, kind of coexist. And people may have more of one than the other. But largely, we're talking about chronic bronchitis. So that's kind of thickening inflammation and narrowing of the airways, the windpipes in the lungs, or emphysema, which is destruction or breakdown and damage to some of the spongier parts of the lungs, the business end of the lungs, I would say, where the oxygen and gases go in and out of the body. But we know that the causes of both of those often overlap, and smoking is typically the single largest cause, although there are people who suffer from COPD and are not smokers and were never smokers. So over the years, using an umbrella term has helped to kind of, I think, cluster those two conditions together and try to just refine the message, which is that, smoking is the predominant cause. Getting tested early helps to refine treatment and reduce progression and slow progression, if not stop it, and also identify the needs of the individual.
Right.
So we're obviously very keen to kind of get the message out. Yesterday was World COPD Day, and there was a number of events being run by COPD Ireland, COPD Support Ireland, mainly trying to encourage the simple things that people can do, as opposed to the complex stuff which we have to worry about as the nurses and doctors looking after the condition. When it comes to individuals, there's a lot of simple, straightforward messages that don't have to be particularly complex or confusing that we like to get out there.
Right. So obviously early diagnosis would be very important, wouldn't it?
Yes, early diagnosis is crucial, and fortunately, this is a chronic disease that can take a while to really manifest. The way we diagnose it typically is based on breathing tests, a particular type of test where you blow into a machine. Usually we would say to someone, if you are a smoker, but even if you aren't and you have significant breathlessness, chronic cough, recurrent chest infections, those are good reasons to talk to your primary care physician, your GP. And one of the great things that's happened of late, and is still in evolution, but is rapidly advancing, the HSE have developed a community, enhanced community care system where more diagnostic tests, so actual tests that historically you would have traveled to a hospital to get done, are going to be more and more available in the community. I work out of a clinic at Bray, and certainly our patients now get referred directly by their GPs for these pulmonary function tests without necessarily needing to come to a specialty clinic. And then the results are reviewed in conjunction with us as specialists in either the hub in Bray or in St. Vincent. So again, the message would be, if you're a smoker or even if you're not and you have symptoms of breathlessness, cough, phlegm, and you're over 35 years of age, talk to your GP about getting referred or considering the possibility of COPD and getting referred for what is essentially a fairly straightforward test in the community.
Mm. And do many people have it without realizing it?
Well, we estimate that it's it along with asthma, the two of them make up the most common respiratory conditions in the world, and actually amongst the 3 or 4 most common medical conditions in the world in general. In Ireland, we think that we estimate about 380,000 people have COPD, but only a third of those would have a diagnosis confirmed. Obviously, your likelihood of being diagnosed probably is a little more likely if your symptoms are more severe, and so your condition is perhaps a little bit more severe. But like we said, it's important for people who have even milder COPD to know early, so that we can intervene and set up the right plan for them to live their lives to the best of their abilities.
Right. And so the event yesterday was designed to encourage people to engage in as much activity as possible, because there's probably a tendency is there for people to do less rather than more when they have the condition.
Yeah, you've hit the nail on the head. So essentially, as I said, there's all the complex stuff that we think about in the background, but at the front line, the message should be that actually people who suffer from COPD often are breathless, and perhaps some avoidance of exercise and avoidance of breathlessness seems logical. The problem is that you then become, I guess, less fit, and so your breathlessness only gets worse. And we would encourage people that once you've been checked and once you've been seen by your doctor and your diagnosis has been made, once that's all been ironed out, actually exercise is one of the simplest and most effective ways for improving quality of life in patient-reported outcomes. You know, we like, from the scientific point, we're often medically drawn towards numbers and harder outcomes like people in hospital, numbers and days in bed and whatnot. But actually, from patient point of view, what patients really care about is, you know, being able to live their lives, not be limited by their symptoms. And the evidence for exercise doing that in COPD is overwhelming at this stage.
Right.
One of the most impactful ways someone can improve their life.
And I suppose it's important to approach the exercise in the correct way, isn't it? Not to do too much at the start and kind of maybe build it up gradually.
Yeah, there's probably two different ways of going about this. First of all, from a direct, from an individual point of view, they can visit copd.ie, which is the COPD Support Ireland, and there's great advice and recommendations there. They also run some virtual exercise programs and advice on those things. Coupled with that, I spoke about the HSE's Enhanced Community Care Program. It's not only about expanding access to diagnostics, but also expanding access to nurse specialists, consultants, but also one of the most crucial parts, respiratory physiotherapists who run pulmonary rehabilitation classes. So those would be a slightly more formal and structured way of structuring exercise routines for patients with COPD. But actually, some of the virtual and just healthy lifestyle advice and simple exercise works very, very well as well.
Right. And would diet come into it to some degree as well?
Yeah, we certainly see that if someone, obviously your fitness and your exercise capacity is in part dictated by your lungs, in part by your cardiovascular system, and then in part just by, so we say broadly, your fitness or rather how trained your muscles are to work with whatever you have. So if you suffer from being overweight, that increases the workload. But also many people with COPD can become underweight because their calorie requirements can go up for various reasons. So if there are issues with your nutrition, weight being too low or too high, that's certainly something we take into consideration. And it's, again, something to discuss with your GP or with your pulmonary specialist, and perhaps require intervention maybe by a dietitian to give some advice around healthy eating.
Right. And people maybe find it difficult to exercise on their own. You were saying they can go, there are special classes they can go to, and they can consult people, trainers who can kind of talk them through what would be best for them.
Yeah, the pulmonary rehabilitation classes are a very specific program that not only involve exercise tailored to patients with COPD, but actually just as sort of a one-stop shop for educating yourself as the patient on COPD, how to deal with flares, how to deal with smoking cessation, how to meet smoking cessation officers. So it's a great intervention, but it's more structured and is between 6 and 8 weeks in duration. You do 2 sessions a week for about 6 to 8 weeks. But actually, some of the online advice and some of the advice provided by copd.ie can give you slightly less formal and less structured things that you can do in your own time when it suits you.
Mm-hmm. And do people kind of hyperventilate sometimes if they kind of, do they get kind of panic attacks if they feel, if they're going up the stairs or something and they run out of breath? Do things like that happen?
They can indeed, and actually you're getting into a fairly technical side of it, but essentially the problem with COPD is breathing air out,
right,
rather than breathing in, and by correlation breathing in, but ultimately you're obstructed from breathing air out. And that's why fitness is so important, because people with COPD need a little bit longer to empty their lungs. And the fitter you are, the less you will need to breathe, the less frequently you'll need to breathe for the same degree of exercise. So absolutely, some people who go into exercise too aggressively at the beginning may, find it very difficult, and it may make their breathlessness much too worse. Yeah. But a graduated program that lets you get fitter over time will essentially allow you to cope with exercise and need to breathe less rapidly, allowing you to breathe more efficiently. And that really is what underpins an awful lot of the benefit of exercise in COPD.
Right. Isn't there something you call puckering up on your website?
Yeah, we call it pursed lips breathing. So that's a technique that people can use to kind of breathe against their own lips a little bit. And in a roundabout way, that can help them feel like it's controlling their breathing and theoretically helps them offload or breathe out the air that's trapped a little bit more effectively. So all of these things are covered, when you meet a program for COPD, there's a lot more logic to the way these things work, and engaging in things like exercise and pulmonary rehabilitation programs, I think most importantly give patients living with COPD a real sense of understanding and mastery of their condition. And when people understand their condition, they're generally much more able to deal with it and feel in control of it.
Right. Has the drop in smoking rates led to any improvement in the number of people with the condition?
Yeah, the smoking rates have dropped. They're still a little bit entrenched in certain age groups and certain demographics. They will undoubtedly help in the longer run. I think the challenge is that these changes that you see in the lungs can take, even from the testing point of view, can take years to manifest. So we think down the line it will make a difference. However, there are challenges like air pollution and particulate matter, which can contribute to COPD as well as chronically under-controlled asthma. So it's not something we're going to see disappear, but we may see a significant improvement as the years roll on. And ultimately, that's an opportunity to drive home the message that really the vast majority of COPD is related to smoking. Right. And the more we can get people to realize the sooner you stop, the more likely you are to stop the progress. We know that people who have COPD, who stop smoking, their lung function will either decline at the same rate as the normal individual, because all of our lungs will age over time. Yeah. They may still decline a little bit more fast than someone who doesn't have COPD, but they certainly decline a lot less fast than quickly than someone who continues to smoke. So the single most important thing you can do is just to stop smoking and seek out help on doing that.
Right. What about vaping? We were just talking about it this morning, and young people in particular, think vaping is harmless. But is there some evidence that vaping can cause lung damage as well?
Yes, so in terms of measure, so there's two different things. There's short-term damage where people get a slightly different condition to a COPD, and this is more of an inflammatory condition called E-valley. But essentially, the second and probably the more pertinent point in COPD is someone could smoke for quite a number of years and not show COPD on the breathing test. We know, though, in the background that the damage is happening all the time. So for someone, one of the challenges with vaping is that we probably haven't had it around for long enough for us to show whether or not it's going to cause COPD. My suspicion is, and I've made this point before to people, our lungs are designed to breathe air, yes. And that's what they're designed to breathe. We do know that vaping can cause inflammation in the lungs, and I think it would be foolhardy to think it won't cause damage down the line. And I make the point that when people have healthy lungs with no condition or disease, I wouldn't prescribe an inhaler. Even medications aren't really designed to be in there. Right. We've prescribed them because we know that the risks are greater than the benefits outweigh the risks. So people should generally try and think, your lungs are designed to breathe as clean as air as you can, and anything you're putting in there has some potential consequences. When it comes to medications, we at least know what they are, and we know that they're outweighed by the benefits. I don't think we can say that about vaping, certainly, and obviously cigarettes have proven over decades that they certainly are not good for you. So,
right. Isn't it true as well that people with COPD are sensitive to air sprays and stuff like that? Or
yeah, people with COPD and asthma will usually report some triggers that can kind of bring on symptoms. There is an overlap between asthma and COPD in the sense that people can have a touch of both. But some people report difficulty with cold air, going from warm air to cold air, or vice versa. Hairsprays. Generally, we would suggest that if you find that you do get symptoms, particularly people would talk about cleaning agents in the house, bleaches and whatnot, that trying to avoid those in the best way possible and just cleaning with warm soapy water or non-chemical means is probably a better way of managing your symptoms day to day.
And with things like open fires in the past, would they have been a factor as well? Burning turf and coal and so on.
Yeah, particulate matter. So any air pollution, and that can include indoor air. When we look at COPD in the emerging countries as opposed to first world countries, biomass fuel and burning within houses would be a much bigger contributor to COPD than it is in the Western world.
Oh, right, yeah.
So undoubtedly in the past it would have been contributing. Yeah.
Yeah. I think we're kind of coming to the end. Is there anything else you'd like to add?
No, I think that the message is the complicated stuff needs to be managed by the healthcare professionals. The simple message is if you think you have symptoms, you're over 35, you're breathless, coughing a lot, and particularly if you smoke, but not exclusively, talk to your GP about getting referred for testing. It's more available than ever. in Ireland now. And if you do have COPD, know that there's plenty that can be done. Stopping smoking is the most impactful thing you can do, but exercising is a huge, huge part, and it doesn't need to be a formal or complicated program. Just being active and trying to keep yourself moving is one of the most important things you can do.
Right, and some people can get advice on the website and get information on all those things we've talked about. Yeah.
COPD.ie is the website for the COPD Support Ireland, and it's got great resources for advice and connections.
Great. Yeah. Thanks very much.
Brilliant. Thank you very much. Thank you for having me.